Hello everyone, my name is Dr. Manish Yadav and I'm here to share with you a tip regarding solving pathological and challenging cases. Solving pathological and challenging cases actually requires a different acumen, I will say a specialized acumen to understand the patient, the disease, and to give relief. Let me share you a tip or a case. I'll share you a case from a very recent one, from a very recent example. In my cancer OPD, a patient came to me. This is just 1 month, just 1 month follow-up. Patient came to me and she was having CA breast, right-sided CA breast. She was already scheduled for chemotherapy in Tata. They came to us and she wanted some treatment for immunity building, XYZ, like that. So she heard that homeopathy can help in cancer sometime. She came to me and I put a lot of my efforts from local to general, mentals to the totality, as every diligent homeopath will do, worked really hard. And I was very happy because I came to a remedy which I was very confident of. I came to a remedy called Apis Malefica. A lot of things written in Mater Medica were matching with this patient. I was really happy, but I was also knowing that just maybe 15-20 days later, she will be going for chemotherapy. And now you can't stop the patient, right? It is their decision. They already had decided that they will be doing chemotherapy, but they came to us. And I said, let me see what best we can do. So I gave Epis 1M and 10M. After giving Epis, 15 days follow-up, which happened, patient was very happy. Why? Because a lot of general symptoms improved. Her pain gone, the swelling gone, constipation, which was there for ages, improved. And as Kent always talks about, especially in his lesser writings, and when generals of the patient improves, you know that you're on the right track. And I was very happy because I could see the changes that are happening. So maybe if she would have stopped, I could have helped her and there was no need for chemotherapy. But yes, she was already scheduled, and in the pressure of family members and of course herself also, she went ahead for chemotherapy. So I told her, whatever your decision is, be in touch with me. If anything happens, I'm there. She goes for chemotherapy and she does not give me a call. I also forgot, I got busy with other patients. After taking chemotherapy, there was severe side effects, severe. Gastritis came in, fever came in, nausea, vomiting, all the symptoms of chemotherapy side effects came in. And she was given all the allopathic medications like, paracetamol, antiemetics, painkillers, everything was given. She was taking. But her vomiting was not stopping. Her diarrhea was not stopping. 3 to 4 days passed. She had become very weak. As you know, a lot of vital fluids are lost. She has not ate anything. There were a lot of aches and pains. Her condition was terrible. And in that state, on the 4th day, she came to me. And looking at her, I was also a little apprehensive. Why? Because her vitals were not that great. I was thinking maybe if this continues for 1 or 2 days more, maybe she needs administration. Hospital administration is needed for this patient because nothing was helping her. So diligently, what I did is that I took the case. I took the case as you take it, the totality, and asked all the acute symptoms. And not to my surprise, there were a few remedies that pop in. And these remedies were basically, one of the remedies called arsenic, Nux vomica, colchicum. These are the acute remedies. Usually you get it when there is a chemo side effects and gastritis and other symptoms set in. And after differentiating few remedies, I came to a point that, okay, maybe I should give her arsenic and then see what happens, because arsenic was covering a lot of symptoms. Her condition was so bad that even a sip, she wanted sips of water, but even sips used to cause a lot of gagging and nausea and vomiting. So I decided maybe Apis, I could repeat the Apis, the same remedy, the indicated one, but I decided not to repeat Apis because Apis totality in acute, Apis totality was not matching. And it was more pointing towards arsenic, probably nux vomica and colchicum. But arsenic was looking very close. And then, of course, generals, you all know that even in pathological cases, the generals has to be understood properly. You have to go from generals to particulars, not particulars to generals. Generals are the symptoms on which your mater medica, your remedy has to be decided. So when I was eliciting her general symptoms, I found out that she had a peculiar taste in her mouth. And the patient used to say that she should like this. I said, why are you doing this like this? She said, my mouth is very salty. It is very salty. I said, salty? Yeah, the saliva is salty, the taste is salty, the food I eat salty, everything is very salty. And then I said, my God, I have handled so many pathological acutes, but this is something different. Salty taste is okay. You get it in some patient, but it was an increased intensity. So it is said that if it is an increased intensity, like in patient, a symptom is there, which you want to prescribe, and it is 3 marks. So the remedy that you're choosing, in that remedy also that symptom should be 3 marks. But arsenic doesn't have, it might be having that symptom in repertory, but not in that great intensity. So much saltiness, so much saltiness. How did this symptom develop? So my favorite notebook, my favorite workbook, Allen's Keynote. Whenever I'm in doubt or I want to give any remedy, I always read Boric and Allen's. I opened Allen's and I started reading Apis. Why Apis? Because I was very confident that Apis had really helped her. Her journals had improved. I was very confident about because how do you know the remedy has acted? The follow-up decides the remedy has acted or not. Patient used to say that, why don't you give me the first remedy because it has helped me so much. And when I was reading Apis, you can open Apis in Allen's Keynote and you go down, down, down. In relationship, you'll find out complementary remedy, natrum muriaticum is written. Natrum muriaticum and salty taste. And of course, when I looked into the repertory sheet, there was natrum mur somewhere. Now I'm thinking, what should I do? Should I give arsenic or should I give natrum muriaticum? And just to check, I said, let me check, because arsenic is very commonly given. As the drug causes side effects of gastritis and everything, there are bound to happen that arsenic and colchicum, nux vomica, ipecac symptoms are very common symptoms also in this acutes of pathological cases, especially after chemotherapy. Nux vomica also one of the remedies. And just on that basis, and the salty taste and complementary, and I was so confident about Apis, I said, let me try natrum muriaticum. Gave natrum muriaticum at 1 o'clock in the afternoon. Every 3 hours, I was in touch. 1 m in water dilution every 2 hourly I gave. She gave me a call in evening 6 o'clock. 30% she was better. At least she could sit down and talk. Okay. 10 o'clock again, I had a call. Around more 20-30% she was better. Around 50% she was better. And in the morning, again 10 or 11 o'clock, we had a call. She slept properly. Her pains, her aches, nausea, vomiting, all the discomfort went off. She slept. She had not eaten for days, for 3-4 days. She ate some, soft food like bread, butter, and jam, and something like that. Okay, khichdi. She ate some soft, solid foods, and her complaint completely abolished. Isn't that interesting? That's why I said that understanding and dealing with pathological cases is not that simple, but yes, it is achievable. If you liked what I shared right now, you have a great chance to come to us. 5 clinicians coming together under the banner of Toshi. We are going to talk about our clinical experiences. How do we handle difficult, challenging cases in our clinics? We get a lot of difficult, challenging cases. Our practice is almost, flooded with difficult cases, right? How do you manage it? What is the thinking process? And the best part is all the 5 physicians or clinicians who are coming towards you, to teach you pathological cases have a different background, different mentors and teachers. So in one session, means a series of sessions, in one module, you can get experience from different people, and you can add to the acumen that you are trying to achieve. You can add one more quality of handling these kinds of cases. So in that way, we are going to go ahead. The good news is that we have started a free session before we start our course. And this free session is basically for people who are, especially who are serious people, to give them a glimpse of exactly what we are going to do. So on 13 March, you should not miss it. 13 March, we have a session by one of our speakers, Dr. Pravin Painte. He's going to talk about some tips about pathological cases. So do attend it and add more feathers to your wings. Thank you very much.